Well, it's a pretty scary statistic. 90% of women have one or more risk factors for developing heart disease. And as we head into February, yes, it starts in just a few hours. How crazy is that? It's American Heart Month, so we invited Dr. Lori Tan with Providence Heart Institute to talk with us. So a lot of people don't realize, but heart disease kills more women than men each year?
Absolutely. So heart disease is the #1 killer of women in the United States.
Wow.
It kills more women than all types of cancers combined. And moreover, if a woman has a heart attack, she's actually more likely to have complications and she's more likely to die in that first year than a man.
Wow.
Yeah.
That's terrifying.
Yeah, it is.
So a lot of people, at least I'll speak for myself, when we're younger and you think, oh, I don't have to worry about this for at least 10, 20 years, but is it something that everyone should be thinking about?
Absolutely. So, 80% of heart disease is preventable. So it starts
80%?
80% of heart disease is preventable.
That's a lot.
Yeah. So, it starts really with lifestyle, and lifestyle starts from day one. So even in childhood, we should be teaching our children how to eat right, how to exercise, how to be active.
So those are the main things, trying to eat healthy, exercise.
Yeah, so there are risk factors that you can control, and that includes making sure your blood pressures are well controlled, making sure your cholesterol is well controlled, managing your blood sugars, not smoking, being active, and avoiding obesity.
And then what are some of those risk factors that people can't control that we already have that you might not know about?
So the major risk factor that can't be controlled is a family history of heart disease.
Oh, okay. What are some of the other ones?
Well, that's really the biggest one.
Yeah.
Everything else, you can probably change the course of how things turn out.
Wow.
Yeah.
So just get to know what's going on in your family and what's been happening.
Mm-hmm. And then really work hard to make sure that those risk factors that you can control are under good control.
Mm-hmm. Now, one big thing, of course, is heart attacks. Are there things people can do to prevent them or just know when something is happening?
Yeah, I think it's important to really pay attention to your body and to know your symptoms. Chest pain is still the most common symptom of a heart attack, but for many people, especially women, they can have atypical symptoms. They often describe the chest pain as more of a tightness or a burning sensation or a heaviness sensation. They may just have shortness of breath or significant nausea with physical activity. I've had I've had multiple patients come in with heart attacks thinking that it was just heartburn for all night and hours that they've had. Yeah.
For hours. And they're having a heart attack.
Yeah.
What?
Yeah. The symptoms can be very confusing sometimes.
Now, what about blood pressure? Because I heard that the recommendation was lowered recently. So what does that mean?
Yeah. So the American Heart Association now recommends decreasing the threshold for treatment for blood pressure from 140/90 to 130/80.
Wow.
Yeah.
Okay. So people should pay attention to that too.
Yeah, absolutely. So the current recommendations recommend starting with lifestyle changes, and if that's not sufficient, then starting medications in certain patients.
Now, since it is about to be American Heart Month, which is what you've got your red on.
Yes.
Wearing my red, is that what we should be wearing for American Heart Month?
Love your red.
Excellent. Starts in just a few hours. As we mentioned, what other things are happening at Providence for the month?
Yeah. Well, at Base Camp, our Cardiac Wellness and Prevention Center at Providence St. Vincent Medical Center, we have great activities. There's free yoga classes almost every day. There's Zumba, Tai Chi, nutrition classes, meditation classes. So lots of great opportunities and resources for our patients to learn how to get healthy and stay healthy.
That's so fun. And of course, this month, when people are thinking about their heart health, they should go do that. But those events are happening all year round?
Yes, so we have those activities almost every day of the year. And once a month, I host a special women's tea and talk. We talk about a special aspect of heart health in women, particularly. We usually hear from a survivor of heart disease, that's a woman. And then we do a 30-minute yoga class or a nutrition class or a cooking class together. So really just a wonderful women's wellness group. We're also starting a book club, actually, quarterly. The first book is The First 20 Minutes, How to Exercise Better, Train Smart, and Live Longer. So
part of it is just taking the time to go do these things. A lot of them are free that you can just take care of your body and think about it and
learn how to be heart smart.
Yeah. Now, if people want more information, where should they go to find it?
So www.basecamp.org. Welcome to basecamp.org, I'm sorry.
Welcome to basecamp.org. That's so excellent. Thank you so much for sharing all this information, and happy American Heart Month.
And same to you.
Of course, it's Valentine's Day in a couple weeks, so that gets people thinking about hearts in different ways, but thank you so much.
Thank you.
We'll be right back.